meeting, and I'm supported by Thomas Radbourne as the Zoom host. Before we start, I'd like to explain that the meeting is being live streamed via YouTube, so members of the public are able to follow proceedings. There are no fire alarms tests planned today, but in the event of an actual fire alarm, we must leave the building immediately via the emergency exits. The assembly points is the Dolphin Pub car park. If the lockdown alarm sounds, we will remain seated and await instructions, and the meeting will be adjourned until such time as it is safe to proceed. Do members have any questions about the way in which the meeting will proceed? No, thank you. So the first item of business on today's agenda is to elect a chairman of the Health and Wellbeing Board for the 2025-2026 municipal year. Are there any nominations for chairman? Councillor Codling. Thank you. Does that find a seconder?
Yes, I'd like to second that.
Thank you. Are there any other further nominations for chairman? No. In that case, all those in favour of electing Councillor Nigel Foot as chairman, please raise your hand. Anyone against? Any abstentions? Thank you. I can declare that Councillor Nigel Foot is elected as chairman for the 2025-26 municipal year.
Thank you very much, Gordon, and thank you very much, members. So it gives me great pleasure to be chair. Please bear with me because obviously this is the first Health and Wellbeing Board that I've actually chaired. So I won't be that familiar with people's names and everything, but you will have all noted that we have an extremely packed agenda. I want to try and do my best to make sure that everybody who wants to speak has a chance to speak. But I would ask those that do speak to try and be as concise as possible so that we can try and keep to time if we can. Thanks very much. So I'll just ask for the next agenda item, please. Sorry, so my first job is to elect a vice chairman. Do we have any nominations for vice chair? I think we have one, I think. Is that correct? Yeah. So it's Dr. Ben Riley. He's proposed. I'm proposing Dr. Ben Riley. Do I have a seconder? Thank you very much. That's Councillor Codling. And could I have a show of hands, please, for all those in favour of electing Dr. Ben Riley as vice chair of this committee? Okay, thank you very much. I can declare that Dr. Ben Riley is elected as Vice Chairman of this Health and Wellbeing Board for 25-26. So item 3 on the agenda, apologies.
Thank you, Chair. We have received apologies from Dr. Ben Riley, Jessica Jundu-Evans and Dr. Janet Lippitz, and Dr. Abid Irfan is attending as a substitute for Dr. Ben Riley, and Rebecca Cullen is attending in place of Dr. Janet Lippett.
Thank you very much. So moving on to item 4, minutes of our last meeting. I hope everybody has had a chance to have a look at those minutes. Could I have a proposer that we accept those minutes as a true record of the meeting, please? Thank you. Councillor Codling. Thank you. And do I have a seconder for that? Okay, could I have a show of hands then for all those in favour of accepting the minutes of our last meeting, please? Thank you very much. If you bear with me, I think I do have to just sign those and then we can move on to the next agenda item. So moving on to item 5, actions arising from that meeting. The board's invited to note progress with the actions and check if there are any further updates or questions or comments in relation to any of the actions. Thanks. Thank you very much. So moving on to item 6, could we have any declarations of interest, please? I don't see any, so that's a no. Moving on to item 7, public questions. And I believe we have Miss Paula Saunderson attending remotely via Zoom. I'll just liaise with Gordon Oliver just about that. If you could bear with me just for a moment, thanks. Okay, so Ms. Saunderson's first question is addressed to and will be answered by Dr. Abid Arfran. Thank you.
Thank you, Chair. The question was around CHC assessment process. So the CHC assessment process considers if an individual has a primary health need.
Dr. Ahmed, sorry, could I just hold you there? Could you, for the benefit of people that might be watching, just explain what that acronym is, please?
Sorry,
first.
yeah,
Thank you.
Yeah, sure, yeah. So CHC stands for continuing healthcare. So the continuing healthcare assessment process considers if an individual has a primary health need based on a multidisciplinary team assessment and recommendation. So if the decision made by the Integrated Care Board is that the assessment demonstrates a primary health need, then the Integrated Care Board Health is responsible for funding all health and social care needs for that individual. This is not means tested, and therefore the continuing health team would not have data relating to funding status of individuals, as this is not relevant to the continuing healthcare funding decision. So a new continuing healthcare leadership team have been in place for just under a year, and have been working with the local authority to review population health data to consider if there are variations in referral into this service. The team are undertaking specific checklist training with community services to ensure that individuals who have health needs and may require an assessment for continuing healthcare are appropriately referred into that service. Referral rates from analysis have increased over the last year alongside eligibility, and this data has recently been shared with the Health and Scrutiny Committee.
Thank you very much, Dr. Arfran. And could I ask Paula, do you have a supplementary question, please?
Well, I'm not sure that the question was actually answered about the balance of awards. Most people get awards through adult social care, but as we know, with the push to have hospitals at home, there are less people under the adult social care radar, and many families delivering end-of-life care at home. So the question was really about the balanced consideration of those self-funded families. I call them that even though funding is not the criteria. So perhaps some more information about the ratios of award, please.
Thank you very much, Paula. I'll ask Dr. Arfran, can you come back on that at all, please?
I'll have to come back to, if we can take that back to the ICB, and I'll get a specific team to respond. Could you, if you can be crystal clear on the ask, that'd be helpful, Gordon. If we could just minute that, and then we can come back to me outside. And
okay, thank you.
The words are balanced consideration.
Thank you, Paula. Moving on to your next question, that will be answered by Mr. Paul Coe.
Morning, Ms. Saunderson. Good to have your question. Thank you very much for it. So the main guidance on this issue comes in the Regulated Activities Regulations of 2014, which come under the Health and Social Care Act of 2008. Those regulations don't focus specifically on minimum sizes, but they do set out the requirement clearly that premises must be fit for purpose. In other words, the residents' needs must be able to be met appropriately in that space. There was previous guidance, which is somewhat useful, I think, Department of Health publication, which was called Care Homes for Older People, National Minimum Standards, Care Homes Regulations. And that was first published in 2002. And they do set out specific dimensions. So that's a useful, but not a definitive reference point. But I do think people do use them because they were pretty useful. what I would say is continuing healthcare wasn't referenced in relation to room size in either of those documents. Ultimately, the registered manager of the care home is responsible for making sure that any resident's needs can be appropriately met in their accommodation. And there are some extra sort of safeguards. So the Care Quality Commission inspectors will also make a judgment on that. And it's worth saying, I think that additionally, West Berkshire Council has a care quality team who undertake checks on services in the district. So you've got a few safeguards there to make sure that the space is appropriate for the person, whether they are eligible for CHC or not. Do you have a supplementary?
No. That's very useful. The Scottish have a 12 square metre type rule, but I'll look at some of that legislation. So thank you very much, Mr. Coe.
Take care.
And coming on to Paula's third question, again, we're back to Dr. Arfan to answer that. Thank you.
Thank you, Chair. So the question relates to continuing healthcare again, specifically around dementia and waitings for dementia. In that assessment. So the response, the National Framework for Continuing Healthcare and Funded Nursing Care was updated in July 22. Continuing healthcare is based on the needs described within 12 specific care domains and does not differentiate between medical conditions or diagnoses. So a dementia diagnosis would have a different presenting characteristics with disease progression, for example, affecting individuals in different ways, which is why the 12 specific care domains is important in catching that and is a more robust way of identifying if an individual has a primary health need.
Thank you very much. And Paula, do you have a supplementary question, please?
So there has been no changes to the domains and weightings since 2022. Is that what my understanding?
So I think it's not a question of weighting, it's a question of, as I've explained in my answer, the different domains. So it's based on 12 different domains as to how the...
Yes.
So,
I understand how the system works, but the Alzheimer's Society and dementia campaigners are still finding that it does not reflect this newer modern disease as well as it does for physical problems and possibly cancers. So you have confirmed that nothing has been done since July 2022 to update that framework. Is that correct?
So all I can confirm is that the framework's updated in July 22, and I refer you back to my answer.
Thank you very much.
Thank you, Dr. Arfan. And again, it's with you. Paula's fourth question, please, if you could provide an answer. Thank you.
So, and this question specifically relates to the dementia diagnosis pathway. So, a Bob Dementia Partnership Group has been working to review diagnosis rates and further develop the joint strategy. So, current contracts, Better Care funding has been secured to extend 2 contracts with service specifications and key performance indicators, which are currently being drafted. So these contracts focus on providing specifically post-diagnostic support for both young people with dementia and older adults and their carers. Additionally, £80,000 of funding, which is going to be spread over 2 years, has been allocated to Alzheimer's Society to address long waiting lists in West Berkshire. This has already significantly increased capacity and reduced waits for dementia care advisor support. With respect to demand and capacity review, plans have been put forward for the completion of a full demand and capacity review to analyse and compare post-diagnostic support across Berkshire West and the Bob Integrated Care Board. Some data does suggest long wait times and variance when compared with other Bob ICB provision, and this will need to be further explored. Diagnostic pathway, with respect to diagnostic pathway review, Berkshire Healthcare Foundation Trust memory clinics have completed a review of that diagnostic pathway, and these findings were shared with a partners meeting on the 17th of September 2025. Thank you.
Thank you very much. And do you have a supplementary question, Paula, please?
No, apart from to say that's very encouraging that all that extra work is being commissioned. Thank you very much.
Thank you. And moving on to Paula's last question, once again, Dr. Arfan, please.
Thank you. So this was a question specifically around, well, the question was around neurodivergent patients and those with dementia. You wanted to understand where you could find a flow chart for specifically the dementia pathway and how the main chunks within that. So I think we've got a slide, on screen, which actually shows the dementia diagnostic pathway, and specifically for neurodivergent patients and those with dementia, it's all integrated into that. So the flow chart provides a brief summary of the pathway, but a more comprehensive and informative flow chart is currently being devised and will be shared shortly. So in essence, the patient will present to primary care. So maybe the patient, maybe their family or carers who have noticed a decline in memory or other function, cognitive function, and so forth. So the primary care team, usually the GP, will use an assessment tool. In this case, the one mentioned here is called GP Cogs, or general practice cognitive pathway. There's other screening tools like the 6CIT, the cognitive impairment tool. So it's a number of questions, and it's like a screening tool, so it assesses patients.
Sorry, I'm conscious you're short of time. That is excellent, thank you. Is that readily available as a handout, say a little A5 leaflet to anyone entering the dementia pathway?
Sorry,
because I've never seen it in any literature. And it's quite important when people are going onto a pathway to understand where they're going.
Do you mean that the flow chart, is this available?
Yeah. It's available in literature that is given to people.
Could I maybe come in on this and just say that I'd like Gordon, as an action following this meeting, to actually share that dementia pathway, please, with Paula, but also I think we will take away the fact that that needs to be widely available for the public, if that's acceptable, from a medical point of view. I can't see any reason why not. Okay.
Reasonable. Yeah, thank you.
Thank you very much. And thank you,
Thank
Paula.
you. Thank you very much. That's very satisfactory. Thank you.
And thank you for raising such important questions. That was very informative. Thank you. Okay, so moving on to item 8, petitions. I'll ask Gordon if we have any petitions.
I can confirm no petitions have been received, Chairman.
Thank you. So moving on to item 9, membership of the Health and Wellbeing Board. And this is just to inform members of the public that a membership of the Health and Wellbeing Board is on an organisational basis, but we have a standing agenda item to note any changes in personnel. Changes since our last meeting are as follows. We have Melanie O'Rourke is now a substitute for Paul Coe. Rebecca Cullen is a substitute for Dr. Janet Lippett, and Ben Owen is a substitute for Rebecca Morgan. Thank you very much. So moving on to item 10, the pharmaceutical needs assessment. I'm going to ask Stephen Bow, if I may, to present this report. Thank you.
Thank you, Chair. So I'll be brief as requested. This is the final draft of the pharmaceutical needs assessment being brought to the board for approval following public consultation. The board has a statutory responsibility to publish and keep up to date a statement of needs for pharmaceutical services for the population, and the PNA, which I'll refer to it hereafter, includes an assessment of whether the current and future pharmacy provision meets the health and wellbeing needs of the West Berkshire population. It also considers whether there are any gaps in the provision of pharmaceutical services, either now or within the lifetime of the document, which will run from 1st of October this year to the end of September 2028. The report identifies the 16 pharmacies supported by 7 dispensing GPs in West Berkshire and the 10 pharmacies in neighbouring areas that are within a mile of the district boundary. The two things to particularly note are that there was a gap identified in the Calcott area in relation to the provision of essential pharmaceutical services, and also the analysis found that the area would benefit from the whole West Berkshire area would benefit from provision of pharmacy first services. There was strong response to the public survey. We had 851 responses, which is really good. There was broad agreement with the PNA findings, some positive praise for pharmacies, especially around quality of service, but also quite a few respondents expressed disappointment about long waiting times in some pharmacies as well. So in conclusion, it's recommended that the Health and Wellbeing Board approves the pharmaceutical needs assessment as presented to cover the period from 1st of October 2025 to 30th of September 2028.
Thank you very much, Stephen. Now, members, do you have any questions? Councillor Brooks.
Good morning, and welcome to your new role, Chairman. There's a lot of things in the report to feel encouraged by. I do hope that the deficiency in the Calcott area may be addressed by a pharmacist coming forward. I've got a challenge and a question. And the challenge is how robust and proactive are we being in promoting home delivery services? Because it doesn't look like there's a particularly good take-up at the moment. Now, in a way, pharmacy to you, as an example, has been a bit of a changer for me. I'm of an age where I need some drugs. And pharmacy to you, I find to be the most simple process to get those delivered to me. And yet, we're not seeing that take up here. And my challenge is, should Health or West Berkshire be promoting these home delivery services in order to bear down on some of the demand and the requirements for people having to go? There's a sort of 20-minute sort of area here we talk about. What are we doing on that? Because it really has a part to play on regular prescription drugs. Then the other side of that, and it probably is in here, but I haven't read every page, is we read of pharmacists providing more sort of triaging and advice in the pharmacy about small ailments, minor ailments, I should say. How is that factoring in? So in one aspect, you've got pharmacies perhaps not having so much to do because of home delivery. And if that continues to grow, that's probably a good thing. But then you've got, as I understand it, Health talking about pharmacists doing more at the triaging stage. There's a dichotomy there I'd like really to understand, and I would like to hear what the professionals might think about doing to promote home delivery, please.
Thank you very much, Councillor Brooks. Could I come back to Stephen? Would you be able to take that, please?
Yeah, thank you. Good questions. The sort of nature of the PNA is really just about quantifying and identifying the provision of these services. So it doesn't directly address those sort of strategic goals that we might be looking at. So I'm not sure I've got an answer for you from the work that we've done on this, but colleagues may well be able to comment on the broader direction of travel in those areas.
Thank you. Dr. Arafan.
Thank you, Councillor. I mean, you make an excellent point. I think you're right. The kind of strategy is for pharmacists to do more and more shifting, that left shift into the community. So as the document says, we're getting them to do more and more BP analysis, contraceptive pills, minor illnesses, all these things, and that'll just grow. And part of that is to relieve the pressure on GP services, simpler, easier access for patients. They don't want to be waiting to come and see me for a wee infection when they can go to the pharmacist and get that sort of ear infection or whatever. But you're right. So we could relieve that pressure. And I think it's about patient choice at the end of the day. And a lot of patients, some of these online pharmacy companies have expanded significantly. And there is a role for them to take on more of that work and relieve that pressure. So there's a whole combination of things here. Premises, is there enough space for patients to have those consultations? Have they got the time? Have they got the capacity? But then again, pharmacies have to still be viable businesses in their own right. So they still need that core bread and butter dispensing. Otherwise, they're not going to rely on the additional services. These are all additional services. So I think it's getting that balance right for them on the extra stuff and doing the day job as well. So it's a difficult one.
Councillor Brooks.
It is going to be difficult, isn't it? If 80% was home delivery, how is the pharmacist necessarily viable? But you know, sir, I suspect that's progress. I suspect that is the way it is going to go. What I'm disappointed in, but I think we need to grasp this, is we have a pharmaceutical needs assessment. We've assessed the need. We've satisfied ourselves the need across the district is okay, is robust. But one of my frustrations with the Health and Wellbeing Board, and I've said it many times, is we should be advising on change and improvement. We are not here simply to say, yes, okay, we know the need is satisfactory. What are we doing as a Health and Wellbeing Board to improve our services, our delivery of services? And that is, we've done an assessment, you're looking at it later about the effectiveness of the Health and Wellbeing Board. We will approve this today, obviously. But when Mr. Bowe says, well, that wasn't really the aim of this, okay, we have a 130-page document that said the needs are okay, except for Calcom. The challenge is, how do we improve these services? And I've given you a couple of examples. That is what the Health and Wellbeing Board, I thought, and needs to be achieving. Maybe there'll be other points on the agenda and we're more positive about this. Would there be anything in the work programme looking at improving the home delivery? I don't know. And maybe, as you say, it's almost a problem, if you like. The more that home delivery goes up, the less viable the pharmacy may be, because they're dispensing less. Now, their business model may need to change. And so they are a broader sort of drug, boots the chemist type thing, where dispensing is a small part, and there's a whole range of other retail offerings. This is progress. That's the work we need to be doing, I suggest.
Thank you. But before I bring in Councillor Codling, I think we as a committee, we have subgroups, and I think this pharmaceutical action, the points that you've raised, Councillor Brooks, we can take away and work on that, because I think there are some important points to make. Councillor Codling.
Yeah, I just want to make a general point that actually this meeting, this first part of the meeting is actually only for the next 3/4 of an hour. And then we're moving into a workshop phase where we're actually going to do the work that Councillor Brooks is asking. It's not necessarily pharmaceuticals today, but, you know, the whole point of the restructure that we had during this last year was to address that so that we actually are effective. These reports we have to bring forward, and Jeff, you're not going to like it, I'm going to use the word statutory. We have to have these reports and put them through. That's why this meeting is curtailed on time, so that we can move into the workshop phase and do some other work.
Thank you very much, Councillor Codling. So on that note, I think we might move on to item 11, and this is our Sorry, I beg your pardon. I've forgotten to approve that report. So, Ms. Purdy, please.
Thank you, Chair. Just to say, if health colleagues did want us to promote the different options that are available to residents around pharmacy, we have a Let's Talk West Berkshire programme where we take outreach information and advice out to our residents across the district. So we'd be very happy to work with colleagues to promote that if that was felt something the board wanted to do.
Thank you very much, Ms. Purdy. So now I would like to ask for a proposer to accept this pharmaceutical needs assessment, please. Thank you. Councillor Gaines, do I have a seconder, please? Councillor Codling, all those in favour, please. Thank you very much. And thank you for your work on this, Stephen, as well. It is such an important thing, and look forward to making some progress on that. So moving on to item 11, we now do come to the Director of Public Health's annual report, and I'm going to invite Dr. Matt Pearce to present the report, please.
Thank you, Chair, and aware we are short of time, but I do just have a few slides to go through, if we're able to share those, please, Gordon. So just whilst Gordon sets this up. So the Director of Public Health report, again, it's a statutory responsibility of mine to produce an annual report of a topic of my choosing. And it does provide a great opportunity to bring attention to potential challenges that West Berkshire are facing, key population health challenges, which I believe warrants that level of attention. And it is my voice and my independent view alone. My views that the views aren't reflective of the local authority or the NHS. It's very much the Director of Public Health independent annual report. So it's a pleasure bringing it here to the Health Wellbeing Board. This is my first one I've done for West Berkshire. And as you would have seen within the papers, this year I've decided to focus on setting the foundations for lifelong health. And firstly, I do want to say thanks to all my colleagues, some of them which are in the room today, for helping pull this report together. I hope it provides a really good summary of some of the challenges facing our children and young people, but also some of the opportunities. And most importantly, what I've tried to do within the report is to reflect actually some of the great things that are going on within West Berkshire. I think I often say that public health has a habit of drawing attention to all the things that are going wrong and aren't going well and some of the challenges, but actually we have a rich voluntary and community sector, which hopefully you can see throughout the report, work from the trust and work from the council that are doing some really fantastic things in this space. I also just want to caveat that during the development of this report, there's been a lot of government policy announcements, actually, which has been really welcoming in Best Start of Life. So there's been a new Best Start in Life strategy that's been published, which again, I think will support many of the recommendations within this report itself. So again, some of you might not be able to see the slides, they're quite small, but the first one really just sets out that the Best Start in Life, getting those developmental opportunities right at the beginning of life is really, really important. And we know that if we get it right, it actually pays dividends in terms of the future outcomes for children and young people. And that can be anything from health, well-being, education, attainment, to employment. And we know that the basic architecture of the brain, the connections during those first years of life are really important, and the brain grows at a significant rate, more so than any other time in their life. Next slide, please, Gordon. And it goes without saying, I think, most people would acknowledge this, that if we invest in the early years, then actually we know that we're going to save the state significant funds in the future. And we know that investing in pregnancy in the first years of life brings about a 9 to 10 times return on investment for every pound that we invest in that area. So it really does make financial sense. One of the other reasons I chose the early years is actually there's still under recognition of the value of the early years in the communities in our public. So whilst we very much work within the public sector and recognise that, there's been a lot of surveys where actually people don't really understand that actually if we get it right, it will actually make a big difference in the future. What we also know has been quite a significant reduction in children's services spending between 2010 and 2023, and those in the council will be aware of some of the financial challenges across children's services. But we know that overall spending in early intervention services across England has fallen by about 1.8 billion since 2010, so a decrease of 44%. And we know that will probably have significant implications on health and wellbeing outcomes. Next slide, please. The other thing I've been quite passionate about, and those of you that know me, I've talked about this before in West Berkshire, is adverse childhood experiences. So this is particularly a growing area of interest where we know that highly stressful and potentially traumatic events or situations in childhood can have significant impacts on children in their later life. And it's something we call chronic stress, if you like. So it could be things such as living in families where they might be experiencing domestic abuse, and parents might have mental health issues, a whole host of trauma that might actually physically affect the child brain, and that can have an impact on that child in later life. My own experience of this was when I've worked in another local authority and we were looking at obesity and weight management services, and we were working with individuals who were significantly overweight. And our traditional response to that approach would be to advise on healthy eating and physical activity. But actually working with our psychologists within the hospital at the time, they found that a lot of those individuals had been sexually abused and experienced trauma, and their coping mechanisms and how that trauma had manifested itself resulted in them gaining significant amounts of weight. So that's just one example in terms of how trauma can manifest itself in different ways. And I think we need to think differently in terms of talking with individuals about what's actually happened to them in their past. And the report does set out some predictions and estimates, a number of people that are actually suffering or have trauma over the last few years. So that's something we need to look at. Next slide, please. So within the report, I'm not going to go through all of these. There's just a summary really where I talk about if West Berkshire was a town of 100 people, what would that look like in terms of some of the health outcomes? So it refers to things such as 6 babies would be born to people who smoke, so around 6% of pregnant women smoking during delivery. 26 pregnant people would be overweight. 12 new babies would be from an ethnic minority group. 70 children would reach the expected level of development in communication, language and literacy skills. I'm not going to go through them all, but it just gives you a kind of a reflection in terms of the numbers and some of the challenges that we're facing. Next slide, please. Obviously, one of the really important things we need to think about is child poverty. So we know child poverty has an impact on overall health outcomes, and the data suggests that about 11% of children under the age of 16 are living in poverty in 23-24, and that equates to around 3,300 children. And we've actually seen levels of child poverty in West Berkshire increased in relative terms by about 52.8% over the last few years. So it's clearly something that we know is not always within the control of the local authority and our health partners, and lots of government policy will have an influence on that. But it's something we need to be aware of. And I know there's lots of work going around cost of living group as one of the subgroups within this board. Slide, please. So the report goes through various different life stages. The first is about preparing for parenthood, and it's really important that we do support families in preparing for parenthood. The report references poor maternal mental health. We know that's one of the key challenges, and we know that it's such an important time for mothers and their children. I think go back a slide, please. I think Gordon. Thanks. I've talked about obesity, so around 26.3% of people in early pregnancy were overweight or were obese. That's similar to the England average, but that's still around 355 adults each year. I've talked about smoking in pregnancy, and actually this is a success story. We've seen a reduction in smoking prevalence amongst pregnant women from 7% down to 5.9%. So that's a really good success story, but clearly we know that smoking can have profound impacts on both the mother and the unborn child. And the other thing is infant mortality rates. This is a really good benchmark in terms of the health of our population. So this looks at the number of infants that die before the age of 1. So whilst West Berkshire is similar to England, 4.5 to 1,000, what we've seen actually has been a slight increase from 2.4 to 4.5 per 1,000 over the last few years. It's just something we need to keep a watchful eye on. And infant mortality is very complicated. It can be to a whole host of reasons, which I've alluded to in the report. Next slide, please. So I touch on nutrition in health is really important. West Berkshire is doing really well in terms of the rate of breastfeeding in babies. So around 75.5% of babies are breastfed at birth, which is significantly higher than the England average. However, this does drop to 56.1% at 6 to 8 weeks. Again, you find that's quite common across a lot of areas in the country, but ideally we'd want to maintain that high level of breastfeeding, as we know that that can be hugely beneficial to the child. And we know things such as early weaning can lead to things such as greater weight in that child as well as stopping breastfeeding. I allude to in the report about something called Healthy Start Programme. So this is a national programme that provides financial support to low-income families, and it helps pregnant women and young families under 4 through vouchers for fresh, frozen, tinned fruit, vegetables, as well as vitamins. So we did a bit of a calculation here as part of this report in that the latest data is around 2022, but about 72% of eligible individuals have applied for those vouchers in 2022, which means that 28% aren't. And we did a bit of a rough calculation on this that equates to around £70,000 worth of unclaimed Healthy Start vouchers. So there's clearly an opportunity for this board and its wider partners to ensure we can promote that. We know health visitors are doing that, but I'm sure there's more we can do. Next slide, please. Another success story for West Berkshire is immunisations. So on the left-hand side of this graph, you'll see that we tend to do well across all our immunisations in children. There's a target of around 95%, and most of them are green, and we achieve better than the national and regional average. However, I think many of us will know that there's certain groups within populations that maybe are more reluctant to have immunisations. I didn't want to mention some of the news from a world leader this week, which was particularly controversial, but it is something we need to be aware about, that how that might fuel scepticisms around vaccinations and vaccine hesitancy. So I think we really need to be on it as a board to make sure we continue to advocate for vaccinations and immunisations to make sure children are getting those. It is by far one of the most effective interventions public health can do. So I don't think we should keep our eye off the ball and make sure we keep on top of that. Next slide, please, Gordon. I know that the Health Scrutiny Committee has touched on oral health. So again, this is quite a challenge across a lot of our areas. So we have 16.9% of 5-year-olds experiencing tooth decay. So that is better than the England average of 23.7%. And again, actually, we've actually seen a success. It's fallen down from 16.9% previously. So, sorry, 29.5% previously. So it has come down, which is really positive. But we know there's more to do in that space. And then finally, I just touch on the physical activity recommendations. I think it was only in about 2011 the evidence was strong enough to really advocate for physical activity in the early years. Most people tend to think about schools, but even getting toddlers to move more can be really beneficial for both their mental health, coordination, cognitive skills, and physical health. Next slide, please, Gordon. I've touched on childhood obesity briefly. So we do measure children in school, the first year in reception year. And again, what we find is that 1 in 5 children are overweight or obese when they start school. So we know that that increases to about 1 in 4 by the end of primary school. But clearly we need to get the early years right. We need to make sure children are eating the right food, getting the right nutrition. The reason why that's so important is that actually 55% of children living with obesity remain obese into adolescence. And we know that once you become overweight as an adult, it's incredibly difficult to get back to that healthy weight status. So getting it right in those first few years is really important. And the graph on that slide just shows there's an association between deprivation. So we know that some of those individuals in our poorest parts of our community are more likely to be overweight or obese. And actually that principle can be applied across all health outcomes. And nearly there. And then the Healthy Child Programme, it's really important we touch on this. One of the biggest contracts at Public Health Fund is health visiting and school nursing, and that is such a vital service. It's one of the few universal services that we have where actually children get their first visit from a health visitor, and we get to see that wider home environment, what the parents are doing, what support they might need, and whether they might need other services or supported to other services. And we know, that could be particularly important in terms of early identification of SEND. And last one is around school readiness. So the government has recently set a target on this where they actually want 75% of 5-year-olds reaching a good level of development. So we know if we can get children into that good level of development right, then again, that they have better outcomes as they get older in terms of both educational and social outcomes. Recently, actually, in West Berkshire, we've seen an improvement in good level of development, which has risen 5.6% over the last year from 66.8% to 72.4%. So we're on target to achieve that ambition of the government of getting 75% from 2028. However, we're also aware that there's that discrepancy between good levels of development between children on free school meals. So again, we've made some improvements. So it's actually gone up to 45% recently, up from 5%, but some way off the average of 72.4%. So there's work to be done there. And we know there's also differences between boys and girls, with boys on free school meals having lower levels of good development. So certainly some opportunities there. Next slide, Gordon. So I won't go through all these recommendations. These recommendations are purely for the organisations sat around this board to reflect on, to consider. I know we're having a workshop in a minute, and the board might want to consider some of these recommendations and the data and intelligence contained within this report as part of that conversation. but it'd be really good to reflect on those going forward. But as I said, I won't go through all of those, and hopefully everyone's had a good read of the report that explains them in more detail. Thank you, Chair.
Thanks very much, Matt, for that summary. I've got a question from Councillor Codling. Thanks.
Less of a question, more of a statement. I absolutely, as lead for Children's Services, absolutely welcome this report. It covers so much that Anne-Marie and I talk about so often, and having had our Ofsted inspection over the last couple of weeks, one of the things they highlighted was the lack of investment in early years. That was certainly and that's across the board. That's not just here, obviously. That's everywhere, but it's something we need to look at. There's lots of good stuff in there, particularly around things like the expansion of our family hubs. That's already underway. You know, there is a lot of work that Anne-Marie and her department, her team are already doing to try and address some of these. And one of our priorities as an administration was actually the improvement of outcomes for children. And recently, and it's a long game. We know we're not going to turn things around in 5 minutes. It's going to make a difference, hopefully, in 5-10 years. It is very much a long game. But something that has happened recently is we are now looking at a programme called the LIFT project, which is Low Income Family Tracker, and it's taking DWP data and looking at where people might get more benefits, and this is direct, as I say, directly from the DWP. And one of the areas that is really useful is around free school meals. Other authorities have used this, and the number of families that were able to then take free school meals, and that also affects the income that schools get. That has an impact. So there's a lot of work that we're already doing, hopefully hand in hand with public health. Thank you, Matt.
Thank you, Councillor Codling. And I've got Councillor Brooks next, please.
A good range of recommendations. I think there was 12 on your slide, and I'm looking at 13 in the report. So I'll leave it to you, Matt, to find which one perhaps dropped off. There are some in these recommendations that actually you might like to think are quite low-hanging fruit. We will see. So taking, for instance, better data and information sharing across agencies sounds straightforward. In my experience, sometimes it isn't. It's a challenge, and it ought not to be a challenge, but we'll keep working on that, I feel sure. Develop a health promotion program for early years settings. That's within our control. I'm looking at stuff that can be done quite quickly, and within our ability to do so. So there's 2 or 3 things here in terms of better information and signposting. Number 7. This is stuff we can do. We can improve. Others are much more complex, much more difficult. We're going to take much more time. But we are, as Councillor Codling knows, in West Berkshire Council, addressing many of these points. So my question is this: what's a child-friendly district, and how do we become one? Because it's such a big and subjective statement. Are we child-unfriendly? You really do need to build that out, I think, on what good looks like, having made that statement, please.
Happy to answer that. Anne-Marie might want to come in if she wants to as well. I mean, that's something, there's something called a UNICEF Child Friendly City programme. It can be quite a costly programme, but what it's about is putting children at the heart of everything that we do. There's significant corporate buy-in within the councils, there's significant buy-in from members, other organisations. So it's really just considering that it's a bit like health in all policies. Everything we do, we consider children in all of that decision-making, recognising they're the future. And I know some of that is kind of already in place, but I think it's bringing it to another level. A lot of the local authorities tend to implement it when they've had quite poor Ofsted reports. I think for me, it's good to get on the front foot and consider kind of what that might look like. And if that's something that the council and partners might want to do, it's something maybe we could look at, say, okay, what would that actually look like in practice, and to give a bit more detail for us to sign up to. Well,
I'm going to give you a door here. You are aware, I'm sure, of the executive briefing, where the executive here receive reports, consider aspects, and make decisions. They may have to go to executive proper in public or full council. But I'm giving you an invitation to bring something like that through to our executive briefing.
Yeah, thank you very much, Councillor Brooks. I've got Councillor Stewart and then Anne Marie. Thanks.
Thank you. And thank you, Matt, for an amazing report. Actually, it was very easy to read, but some of the stats were horrible to read as well, of course. One of the ones that I don't think we've mentioned, or certainly it came out to me, and it might be one of the ones that was missing off the 13, I don't know, was around housing quality. And leading on from what Councillor Brooks said, the fact that what's within our grasp, what's within our control as a local authority. As far as I'm aware, we still don't have our own housing stock, although that is something that we've looked at certainly over many years. So this is about social renting and private renting homes. And in particular, where you see some of the stats, which I won't read out, but the stats in particular talking about things like mold growth and asthma. And in one of the papers that we're going to look at in our workshop, where we're talking about long-term conditions and asthma being one of the top 5, I think, in terms of prevalence. So I think that one is a really interesting point and something that would be really good for this board and this local authority to think about.
Thank you very much. Can I come to Ms. Dodds, please? Thank you.
Thank you, Chair. Firstly, I want to thank Matt for the report and bringing these issues of early childhood to everyone's attention. It's hugely welcomed from a children's services perspective. I do agree with the recommendations that Matt has captured there, and I likewise hear the leaders' call that we're knocking on an open door about child friendly, and we'll commit to working with Matt on what child friendly would look like. And I think just latterly picking up Councillor Stewart's point there, I think if we do work to child friendly, that would absolutely speak to some of the issues around housing stock or how we accommodate children and families across West Berkshire. But it is opportune on the back of that, I think, to recognise that the majority of the children that we care for are cared for within West Berkshire. Our care leavers are also cared for and in suitable accommodation. And likewise, I think the council in the last 2 years has made huge strides in how we house vulnerable families, that we don't have children anymore in temporary or bed and breakfast accommodation. So where there is always more work to do, I think it really is important to recognise that child friendly. I think a lot of our approaches across the council are child friendly, but I think it is incumbent upon us at this stage to pull that together in a policy that we can speak to, that underpins everything that we're already doing. So it highlights that to children and families and to the wider public. So I think that's all from me, but massively thank you. Can you now do the same on SEND, Matt? That would be fabulous.
Thank you very much. If I may just make a few comments of my own. I was delighted to read this report. I agree with Councillor Stewart. It was an easy report to read. And one of the things I'm very keen on is that anybody outside, a layperson, can pick it up and understand it. And that is critical. I love the diagrams, the infographics. I like the 100 people, you know, if our district was 100 people, you know, how many people would have health conditions. So I thought all of that was excellent. And if I may finally just sort of say, in my portfolio area, you know, this presents a massive opportunity because I cover culture and that includes libraries. And we're very, very keen to put out that public promotion about picking up, you know, unclaimed benefits and spreading the word. So I think there's a lot of work we could do there. And my final point is, you know, as a council, we're very conscious of funding and money and how we're short of it. But I think you said, Matt, that for every £1 we put in at early years investment, we get a 9 to 10 times return on investment. And that is massive. So we should all, I think, be very conscious of that. So thank you very much for that report. I would say that the Health and Wellbeing Steering Health and Wellbeing Steering Group, it was suggested that partners for the Health and Wellbeing Board be asked to commit to actioning this report's recommendations. And Matt, we'll ask you to come along again in 6 months' time and give us an update on how we're doing on those recommendations that you put forward. That's great. This is a noting of this report, so we don't need a vote on that. So I'd like to move on now to item, and thank you, Matt, for that report, and we'll move on to item 12, Better Care Fund Plan, please. And I think that's Mr. Coe will be presenting that. Thank you.
Thank you, Chair. Yeah, I'll keep it relatively short. This is a bit of a catch-up activity in the sense that the plan was submitted some months ago, and the money's been received, and we are processing along the line set out in the plan. Really important piece of work, joint work between the local authority and health system in particular. It's the national picture is that we're really clear on what we're trying to achieve here. For example, keeping people out of hospital, helping them to get out quickly, etc. So lots of that. It's a significant amount of money, of course, set out at page 250 of the pack. So this is the formal process, bringing it back here for endorsement by the board. But I recommend it strongly. Thank you.
Thank you very much, Mr. Coe. Any comments, please, on the Better Care Fund plan for 25-26? Okay, well, I would like to ask for a proposer for this, to accept this plan, please. Councillor Codling, and do I have a seconder, please? Councillor Gaines, all those in favour, please. Thank you. So we accept that report. Thank you. So moving on to item 13, the response to the Local Government Association review of the Health and Wellbeing Board. And I'm going to come back to Matt Pearce to present this report, please. Over to you, Matt.
Yeah, thank you, Chair. So I think many of the board will know we've undertaken a bit of a process over the last year or so. So it was back in July 24, we came together as a board, recognised and reflected that the board probably needed to work differently. And maybe whilst there's some great work going on, we felt we needed to think how we might be more effective as a board in making real change to people's health and well-being. So this report sets out the findings of the review. So I subsequently invited the Local Government Association to come in, as you're all aware, and they did a review speaking to stakeholders and members of the board between December and February 2025, and that culminated in a workshop which many of you were involved in April 25, and that fed back the findings from the review. I'll quickly summarise those and I'll go into the recommendations, which I think are probably the most important. The first from the recommendations was that the board needed to become more strategic in partnership, being equal partners and actively working together to focusing on those key issues for population health. And I think there was a challenge as well about the board needing to demonstrate the additionality. So what is the difference of us coming together as a board? What are those things that we're actually changing within population health? It talked about having a more proactive 12-month forward plan. There was agreement that we needed to move away from committee meetings into more informal meeting workshops, as it was felt that these were often more productive and impactful in terms of exploring the options and potential course of action. Members didn't necessarily like the formality of some of these meetings, and it wasn't necessarily conducive to good partnership working, and sometimes it stifled participation and open exchanges of views. It suggested that the board should have a small number of priorities. So the board works the joint health and wellbeing strategy, but there's lots of priorities in there, and often the board spread themselves too thin, and it wasn't always clear what were the things we were actually trying to change and make a difference on. There was widespread support for around the board wanting to focus on need and evidence. So again, the subsequent workshop we're having later today is about what is the joint strategic needs telling us? What is the population data telling us? We've just covered some through the Director of Public Health annual report, but it's the so what question and what are we going to do about it? And it felt we should be more creative, solutions focused, and rather than just policing performance. And there was agreement that we wanted reports to be for decision rather than for information. So again, recognising where we could, have that added value and then a stronger relationship between the board and its subgroups. So following that findings from the LGA, a small subgroup of individuals came together, which is listed in 5.8 of the report. They pulled together several proposals for the board to review and endorse today at this meeting. And some of these are quite radical, but I'm hoping they'll get some support for them. The first one was around development of a health and wellbeing board compact. So again, this just defines the shared principles and expectations of how we're actually going to work together as a strategic partnership to deliver meaningful change. It's proposed that we move from 5 formal health and wellbeing board meetings to 3 from 5 formal meetings to 3 per year, and these will be in person, relatively brief, and focused on reports where formal decisions are made. Given that the Health and Wellbeing Board is a committee, the council meetings will still be required to take place in public with publication of formal agendas and meetings. And obviously members of the public will still be asked, will still be able to ask questions. And I think it's important in this time, we're not excluding the public. We actually want more engagement with our communities and the public. And that was really clear in terms of what the board wants to do. So we're looking to do that through a different way. And that might be through informal workshops. Once we've had formal health and wellbeing board meetings, it's proposed it would be followed by informal strategic meetings focused on kind of plan, do, review cycle, focusing on the how and what the things we're going to do. And again, in that spirit of partnership workings. In addition to that, there'll be informal deep dive workshops. So these were previously well received by the board. So again, bringing in additional partners, stakeholders, getting that wider views and perspectives about how we might be able to improve on some of the priorities that the board identifies. We're proposing the membership of the Health and Wellbeing Board is updated to ensure sufficient seniority. The board really needs to make sure it's got those system leaders that can unblock problems. That system leadership principle going forward. And the membership list can be found in Appendix B and obviously be subject to agreement by this board. The JSNA will be updated and I'll be able to show the update on that following this meeting, and we use that to identify a long list of priorities, which we can then pin down to a few smaller priorities. And again, we'll be looking at that in the workshop that follows. Once the priorities are agreed, we then allocate that to the subgroups. A form follows function. So which subgroups do we need to stand up, step down? How do we allocate those priorities across those subgroups? There was a lot about how we monitor impact as a board. So how do we know we're making a difference? And there's a recommendation about having a clear outcomes dashboard that will demonstrate that impact of need and progress. However, I think we recognise that some of these challenges are longer term and they might take a little bit while to shift the dial. As part of that, we will need to review the health and wellbeing subgroups, again, reflecting the priorities that are identified by the board. And then we're also proposing that a Health and Wellbeing Board steering group is disbanded with subgroups then reporting directly into the board through to the informal partnership meetings. I'll probably stop there. There's quite a lot of recommendations in there and there might be some questions from board members, but that's it. Thanks, Chair.
Thank you very much, Matt. Could I open it up for any questions for Matt following that report? Councillor Brooks.
So I'm encouraged by this new format. I look forward to these workshops coming forward with some real recommendations of what we should be trying to achieve. I suppose I was the most vocal critic that we seem to meet and note and agree a whole bunch of things without actually agreeing what we should do to improve the health experience in our district. So this will, I think, be a good step towards achieving that. Thank you.
Thank you very much, Councillor Brooks. Any other comments from any members? Okay, well, if that's the case, our recommendations are that this board endorses the proposed changes to its governance arrangements and working practices as set out in section 6 of this report, and agree that these be referred to the council for final approval. So can I have a vote, please, on that aspect first, if that's okay? Anybody happy to propose that? Thank you, Councillor Codling. Do we have a seconder? Thank you, Councillor Keynes. All those in favour, please. That's lovely, thank you. And then moving on to the second recommendation, that this board be informed that the proposed changes will require amendments to the council's constitution, the final wording of which will be delegated to the council's monitoring officer in consultation with the Constitution Review Task Group. Do I have a proposer for that? Councillor Gaines, and do I have a seconder? Councillor Codling, thank you very much. All those in favour, please. Thank you very much. That's really good. So moving on to item 14, I'm going to ask Dr. Arfan for an update from the Integrated Care Board, please. Thank you. Okay. Yes. Sorry, Dr. Arfan, I apologise. It's just if there's anything you'd like to highlight that you'd like to bring to the attention of the board. Thank you.
As colleagues will be aware, one of the main things that's happening at the moment at the ICB is kind of the ongoing reorganisation. So the latest position on that is probably relevant, is that the ICB announced yesterday that the first aspect of that will be the senior team. So we've had Dr. Priya Singh as a chair, and the next phase of the kind of reorganisation will be that the chief exec designate will be announced, and that's not been confirmed yet. And then there'll be the executive, so all the direct reports into the chief executive, and there'll be a consultation around that with a timeline over the next kind of 4 to 6 weeks. So once that is settled and the direct reports into the chief exec are appointed, then they will then probably complete the work on the organizational redesign, with the idea being that the ICB will move into the new Thames Valley ICB from subject to any delay or changes from 1st of April next year. That's the kind of identified timeline.
Thank you very much, Dr. Arfan. And just for the benefit of any members of the public that might be tuning in, can you just outline what the Thames Valley area consists of geographically? Thanks.
So the proposal is it'll be the current geography, which includes West Berks, Buckinghamshire and all of Oxfordshire, but with the addition of the majority of kind of Frimley. So Frimley at the moment, some aspects, small amount will go to the south to Hampshire, Isle of Wight, and then a small amount will go to Surrey. The majority of it, roughly about 500,000 patients, will be incorporated into the Thames Valley new geography for the Thames Valley ICB.
Thanks very much for that clarification. I have a question from Councillor Marsh.
Thank you, Chair. So this streamlined financial envelope that the report refers to, according to a report in The Guardian, the process has been delayed because of the sheer cost of making half the staff of the ICBs redundant. So I just wondered what the implications were for the staff at this ICB, and particularly, as this is West Berkshire Council, particularly as many of them must live and work in West Berkshire. So it's really about the implications for the staff and what future they face, and what conversations have been held with them.
Yeah, so no, that's a very good question. So the budget available has been significantly reduced to £19 per head. So obviously the working assumption is that 40 to 50% of current people employed by the ICB will either be redeployed or made redundant. So that's a fact. As to what that looks like, still to be determined. So at the moment, the first step for some of those employees is that we've just gone through, or we're just about to close off a round of mutually agreed resignation scheme, a MAR scheme as it's been referred to. So those maybe certain individuals may be in a position where they might want to take that opportunity and move on to another role. But the bulk of that kind of redesign work, as I've outlined, hasn't been done yet. So, and there are still some pieces, kind of, it's like a chessboard game. So there's still some pieces as to what's in that £19 per head, as to what can be counted against those costs and what can't be. So it's not quite settled yet. So it's difficult to say what the implications are, because let's say, for example, we spend, 10 million, we were talking about continuing healthcare earlier, huge spend for all the, say, nurses and so forth. involved in doing those assessments and so forth. Let's say, for example, it's £10 million out of our £19 per head budget. Now, if that was in the £19, then obviously that's a big cost just absorbed by the continuing health team. But if it's somehow managed outside, then we've got a bigger budget to play with. So I think there's a number of things which need to be confirmed before we know what the implications for the staff are. But there will be implications. And obviously, and staff will be supported as always within any organisational redesign. And the unfortunate thing is, this is the third reorganisation we're kind of going through within the space of 3 years. So I think hopefully this will be the last one, subject to any future changes. But yes, it's difficult for all staff involved.
Thank you very much. Any other questions for Dr. Arfan? Okay, thank you. So then I think we can move on to item 15, which is changes to pharmaceutical services. And now we've heard already about the joint pharmaceutical needs assessment. I'd like members to note that an application for a new pharmacy in Calcutta has been received. The closing date for responses was the 14th of September. We tried to organise a meeting of the Pharmaceutical Needs Assessment Subcommittee to agree the response, but could not achieve a quorum. So Health and Wellbeing Board members were invited to comment offline, which we did. The response was agreed by the Director of Public Health in consultation with the Health and Wellbeing Board Chairman and is provided for information. Do Health and Wellbeing Board members have any questions, please? Thank you. Councillor Stewart.
I guess I ought to, as this is in my ward. I haven't got a question necessarily. I'm just, I think actually the letter that was written was really good and a really good summary of the situation that we find in that area. We do, I believe, need some more, we need another sort of pharmacy and medical centre sort of location. But in that area, we do have some serious issues with parking and traffic and those sorts of things. Some of that has been created, unfortunately, by the fact that one of the local bus services no longer services that area. So people are having to drive rather than actually use a bus service. Tylehurst Parish Council are actually taking that up with Reading buses to see whether we can have that reinstated. But we do definitely need that service in this area.
Thank you very much, Councillor Stewart, and thank you for supplying that sort of local knowledge, because anyone that knows the area where this pharmacy is going in knows that it is a challenge with parking. And good luck with the bus question. I mean, I know as a district councillor, you can obviously bring any issues to council as well, which would be helpful. Thank you. Okay, so I think we can now move on to item 16, which is the Health and Wellbeing Board subgroup updates. So this is really just an information piece. Could I ask, do members of the board have any questions on the subgroup updates, please? Okay, thank you. So now we move to standard agenda items. And item 16 in the in our agenda pack is for members' questions. Do we have any members' questions, please, Gordon?
No questions received, Chairman.
Thank you very much. So moving on to item 18, the Health and Wellbeing Board Forward Plan. So I'm going to invite the board to note the forward plan and suggest any changes or additions. So any comments, please, from members of the board on the forward plan? No? Oh, Matt, Councillor.
Yeah, it's probably worth saying that I think the forward plan will be developed once we've gone through the workshop and understand what our priorities are, hence why it's looking very thin at the moment. I just wanted to make that point.
You read my mind. I think that's going to change by the end of the morning. But thank you, Matt, for that observation. So watch this space, I guess we ought to say. Okay, so moving on to item 19, future meeting dates. Can I hand over to you, Gordon? Do we have some updates on future dates, please?
We do have 2 dates in the diary, which are 11th December. Is the next one. However, future dates may be adjusted to recognise the fact that we are moving to 3 meetings per year.
Thank you very much, Gordon. And could I, Councillor Coughlin.
before you finish, firstly, welcome to your new role as chair of the board. I want to thank everybody for the support for the year that I did, and particularly Gordon for the support that he gave me around this, and good luck with it.
Well, thank you very much, Councillor Codling, and thank you for your chairing of this board. It is such an important part of the council, and it's great to follow up on those LGA recommendations to make this a really active agent for change. So I'm looking forward to that. So I think we can thank everybody for coming along. I think we're going to move into our workshop phase now, but I'm proposing we have a bit of a break. Is that right, Gordon? So we're going to reconvene about 11, is that right? Oh, yeah, if people could come back about 5 to, we'll start the workshops. So thank you very much, everybody.